Hi, my name is Dawn Waugh, and I'm a physical therapist at Proaxis Therapy and the program director for our Total Joint Health program. Total Joint Health is a program we developed in conjunction with the physicians at Steadman Hawkins Clinic of the Carolinas for our total knee replacement patients. With our program, patients see a physical therapist before surgery where they may be fitted with a device called Kneehab, which helps strengthen the quadricep muscles both before and after their surgery. Patients who have stronger quadricep muscles function better and have a better recovery after their surgery.
In most cases, when you receive your Kneehab, a healthcare professional will help you set up your device for the first time. It comes in 2 boxes, one with the controller and one with the garment. The person helping setting up your device will remove the garment, lay it over top of your leg to measure where the electrodes go. This is specific to you and to the side of the leg that you had surgery on. The markings on the inside of the Kneehab device show the electrode placement. The person setting up your device for you will use these to appropriately place the electrodes. They come in a separate container, and there are 4 of them, each matching like a puzzle piece to the areas outlined on the back of the Kneehab. Take each of them out of their little container. And if you were going to replace your electrodes, you will put them back in the exact same spot that the person setting up your device had placed them initially. The grid side that looks slightly metal will always go face down onto the device. Press firmly so that they stick, and continue to do the same thing for all 4 of the electrodes until they are firmly attached to the device. Peel back the layer that protects the electrode gel. This layer is very important because it helps keep the device clean from getting hair or other debris that can stick easily to the electrodes. Then you'll place the Kneehab right on the top of the kneecap and slowly place it along the thigh and press down firmly so that the electrodes stick very well. There are 2 straps on the bottom of the Kneehab. Velcro those together so that it firmly holds in place. In the second box is the controller and the charger. Make sure that your controller is charged prior to use. Next, we'll connect the controller to the garment. Make sure that you hold the Neurotech logo with one hand as you connect it with the other. To turn on the device, you'll hold the power button down for 3 seconds. You'll see the screen light up, and 20 minutes should be displayed on the front with program 1 at the top. In order to change through the programs, press the program button on the right side and hold it down for 3 seconds. You'll see the number change at the top, and it can go through programs 1 through 9. Next, we'll turn on the device so that your quadricep receives stimulation, and you do that by pressing the up arrow on one side until you feel your quad muscle contract. Next, you'll turn up the other side of the device until you feel a strong muscle contraction. It will first feel like a light tingly sensation that will get a little bit stronger until you feel the stimulation actually create a muscle contraction within the quad. You should be able to turn the device up as high as you can tolerate without pain. There is a holder on the side of the garment where you can place the controller if you want to walk with your Kneehab or do other exercises that require you to be more mobile or up and off of the table or out of the chair. The following are exercises we use with our patients who have had a total knee replacement. While all of the exercises are important, some of the basic exercises will not use the Kneehab device. These are heel slides. So while sitting or laying down, slide your heel towards you until you feel a stretch in your knee, then slowly straighten the leg back out again. These are heel slides with a strap. So while sitting or laying down, place a strap around your foot and use your hands to pull your heel towards you until you feel a stretch in your knee. Then slowly straighten your leg back out again. These are chair slides. So while sitting in a chair, slowly slide your heel back under the chair until you feel a stretch in your knee. You can help your foot slide better by using a furniture slider or by using your sock to slide along the floor more easily. These are wall slides. So laying on your back with your foot on the wall, slowly let your foot slide down until you feel a stretch, letting gravity do most of the work. Hold it at the end and then slowly straighten the leg back up again. This is propped knee extension. So while laying down, use a towel roll, pillow, or a bolster to prop your ankle on a surface that allows your knee to be suspended into the air. Relax the knee and allow it to straighten. You can lay a weight over the knee if you need an additional stretch. This is prone hangs. So while laying on your stomach, allow both legs to extend off the edge of a firm surface just above your knee. Relax your leg muscles and allow gravity to straighten the leg. You can add an ankle weight if you need an additional stretch. This is a balance exercise in half tandem. So starting with your feet, one slightly in front of the other, you'll just try to stand still without moving. And slowly nod your head up and down or side to side in order to challenge your system a little more. This is a balance exercise in full tandem. So with one foot directly in front of the other, your heel and your toe touching, try to maintain your balance and slowly look up towards the ceiling or down towards the floor, to the right and to the left, to make the exercise a little harder. This is a single leg stance. So standing on the surgical leg, try to maintain your balance with the other leg up into the air. Make sure that you stand near a surface that you can easily touch if you feel unsteady. This is a seated hamstring stretch. So sitting on the edge of a chair, place your leg out straight and lean forward slightly, keeping your back straight until you feel a stretch in the back of your leg. This is a hamstring stretch on your back. So place a strap around the bottom of your foot and use your hands to slowly pull your leg up into the air. Try to keep your knee as straight as possible so that you feel the stretch in the back of your leg. This is a quad stretch. So laying on your stomach, place a strap around your foot and slowly use your hands to bend your knee, bringing your heel closer towards you. Hold it at the end until you feel a stretch in your thigh, and then slowly let the leg go back straight again. This is a calf stretch. So while sitting or laying down, place a strap or a belt around the top of your foot with your knee straight. Pull your toe towards you until you feel a stretch in the back of your leg. This is a calf stretch in standing. Place the foot to be stretched behind you, and while keeping your heel on the ground, lean forward until you feel a stretch in the back of your leg. This is a weight shifting exercise, so starting with equal weight through both of your feet, slowly shift your weight towards your surgical leg, keeping your leg as straight as you can. You can vary this exercise by stepping forward and back also, getting you ready for walking. This exercise is weight shifting with the Kneehab. So as you feel the stimulation to the quadriceps, you'll shift your weight over to that leg, hold it for the length of the muscle contraction, and then slowly shift back. This is weight shifting forward and back with the Kneehab. So place your surgical leg in front of you as if you were taking a step, and shift your weight forward onto that leg as the stimulation contracts the quadriceps, and then slowly shift backwards as the stimulation relaxes. The Kneehab can also be used while you are walking around your home or in the community. This exercise is a quad set, so place a bolster or towel underneath of the heel and slowly straighten the leg, squeezing the quad muscle as tight as you can, holding for 2 or 3 seconds and then relaxing. This is the quad set with the Kneehab device. As the stimulation goes to the quad, squeeze the muscle, straighten the leg, and hold it for the length of the stimulation, and then relax. This is a short arc quad, so with a bolster or towel underneath of the knee, slowly lift the heel off the surface until the leg is fully straight, and then relax it back down. This is a short arc quad with the Kneehab device, so with a bolster or a towel underneath of the knee, slowly lift the heel off the surface as the Kneehab contracts the quadriceps, and then slowly lower it back down as the contraction is released. This is terminal knee extension with a band, and so with an exercise band placed around the back of the knee, unlock the knee and then slowly straighten it while contracting the quad. This is terminal knee extension with the Kneehab device. So with an exercise band placed around the back of the knee, unlock the knee as the stimulation is relaxed, and slowly squeeze the quad as the Kneehab contracts the muscle, pulling against the resistance of the band, and then relax as the stimulation relaxes. This is terminal knee extension while laying on your stomach. So place your toe on the surface that you're laying on and slowly straighten the leg, elevating the kneecap off of the surface while contracting the quad, and then relax back down. This is terminal knee extension while laying on your stomach with the Kneehab device. So place your toe on the surface that you're laying on, and as the Kneehab stimulates the quad, straighten the leg, lifting the kneecap up off of the surface, and then as the stimulation relaxes, let your legs slowly go back down. This is a straight leg raise exercise. So place your surgical leg straight and the other one bent to protect your back. Tighten your thigh, holding the leg very straight, while you raise it slowly to the height of your other knee, and then slowly lower it back down towards the table. This is a straight leg raise with the Kneehab device. So placing the surgical leg straight and the other leg bent to protect your back, As the Kneehab contracts the quad, slowly lift the leg up into the air and then relax it back down as the stimulation relaxes. This exercise is a step up. So place your surgical leg on a step, place your weight through the heel as you step up, straighten the leg, tighten the quadriceps, and slowly let the leg relax as you come back down. Try not to use your other foot to push up onto the step or to lower you back down. This is a step up with the Kneehab device. So as the stimulation goes to the quad, place your weight through your heel and straighten the leg as you perform the step up. Come back down as the stimulation relaxes. This is a sit to stand, so place both feet shoulder width apart and slowly stand up and lower back to the chair using your hands as little as possible. Try to keep your weight through your heels as you stand up and back down. This is a sit to stand with the Kneehab device. So as the Kneehab stimulates the quad, stand up slowly and then back down as the stimulation relaxes. Try to put your weight through your heels and use your hands as little as possible. These are ankle pumps, so while laying down or with the legs elevated, move your ankles up and down to help improve the muscle pump action in the lower legs. This should be performed very frequently after your surgery to help prevent blood clots and to improve circulation in your lower legs. This exercise is a bridge, and so while laying on your back, bend your knees and slowly elevate your hips off of the surface while pressing through your heels. Try to tighten your glute muscles and your hamstrings as you lift up into the air and slowly back down. This exercise is a clamshell, so while laying on your side with your surgical leg up, bend your knees towards you, keep your ankles together and your hips very still. Lift the top knee towards the ceiling and slowly lower back down. This is a side leg raise, and so while laying on your side with the surgical leg on top, extend the legs slowly behind you, raising your heel towards the ceiling, and then back down nice and slow. Try to keep your hips still and not use your back while raising the leg into the air. This is a straight leg raise on your stomach. So while laying on your stomach, keeping your leg very straight, lift the thigh off the table as much as you're able to and slowly back down. Only lift high enough to the point where you feel your glutes and hamstrings working, and do not let your back hurt during this exercise. These are hamstring curls, so holding onto a surface for balance if you need to, bend your knee slowly, bringing your heel up into the air until you feel your hamstring working, and then slowly let the leg go back down straight. This exercise is sidestepping, so while keeping your hips and shoulders straight, practice taking steps to the side to work on your hip strength. This is sidestepping with a band, so tie a TheraBand around your ankles and slowly step to the side, keeping your hips straight and your shoulders level. These are heel raises, so keeping your feet shoulder width apart, slowly raise up onto your toes and then back down towards the floor.
Both physical therapy and the exercises you just saw using your Kneehab device are very important to get the great results following your knee replacement surgery. Our patients are extremely satisfied at the completion of our rehabilitation program. We hope you enjoy your new knee and getting back to all those activities you hadn't been able to do.